Good morning and welcome to the North Slope Borough Community Health Hour. My name is Olivia Kim, Health Educator for the Prevention Unit. This show is brought to you by the North Slope Borough Health Department. As a disclaimer, this episode discusses cancer and may be triggering for some listeners. This week, we honor Breast Cancer Awareness Month, which is observed in October. I'll be talking a bit about the disease, risk factors, screening, and prevention. About 1 in 8 women will be diagnosed with breast cancer in her lifetime, and approximately 300,000 women and 2,800 men will be diagnosed with invasive breast cancer in 2025. In Alaska, breast cancer is the most commonly diagnosed cancer among women, with specific prevalence data varying by population. Roughly half of all breast cancers occur in women with no specific risk factors other than sex and age. Approximately 0.5 to 1% of breast cancers occur in men. Breast cancer is a disease where abnormal breast cells grow out of control and form tumors. If left unchecked, the tumors can spread throughout the body and become fatal. Breast cancer cells begin inside the milk ducts and/or the milk-producing lobules of the breast. The earliest form is not life-threatening and can be detected in early stages. This is the in situ stage. Cancer cells can spread into nearby breast tissue. This creates tumors that cause lumps or thickening. This is called the invasive stage. Invasive cancers can spread to nearby lymph nodes or other organs, also known as metastasizing. Metastasis can be life-threatening and fatal. Most people will not experience any symptoms when the cancer is still early, hence the importance of early detection and screening. Breast cancer can have combinations of symptoms, especially when it is more advanced. Symptoms of breast cancer can include a breast lump or thickening, often without pain, change in size, shape, or appearance of the breast, dimpling, redness, pitting, or other changes to the skin, change in nipple appearance or the skin surrounding the nipple or areola, abnormal or bloody fluid from the nipple. People with an abnormal breast lump should seek medical care even if the lump does not hurt. Most breast lumps are not cancer. Breast lumps that are cancerous are more likely to be successfully treated when they are small and have not spread to nearby lymph nodes. Breast cancers may spread to other areas of the body and trigger other symptoms. Often, the most common first detectable site of spread is to the lymph nodes under the arm, although it is possible to have cancer-bearing lymph nodes that cannot be felt. Over time, cancer cells may spread to other organs, including the lungs, liver, brain, and bones. Once they reach these sites, new cancer-related symptoms such as bone pain or headaches may appear. Breast cancer treatment typically involves a combination of therapies tailored to an individual's needs. The specific treatment plan depends on factors such as the stage of cancer, type of breast cancer, and the patient's overall health. Some common treatment options include surgery and removal of the cancerous tumor and surrounding lymph nodes, radiation therapy, where high energy rays are used to kill cancer cells that may remain after surgery or to shrink tumors before surgery, chemotherapy, where drugs are administered through injections or pills to destroy cancer cells throughout the body, hormonal therapy, where medications that block or reduce the effects of hormones that stimulate breast cancer growth, targeted therapy, where drugs that target specific molecular abnormalities in breast cancer cells, immunotherapy treatments that boost the patient's immune system to fight cancer cells. Some risk factors for breast cancer include getting older. The risk of breast cancer increases with age. Most breast cancers are diagnosed after age 50. Genetic mutations, inherited changes or mutations to certain genes, such as BRCA1 and BRCA2, increase risk of breast and ovarian cancer. Having dense breasts can sometimes make it hard to see tumors on a mammogram. Women with dense breasts are also more likely to get breast cancer. A personal history of breast cancer or certain non-cancerous breast diseases, Women who have had breast cancer are more likely to get breast cancer a second time. Some non-cancerous breast diseases, such as atypical ductal hyperplasia or lobular carcinoma in situ, are associated with a higher risk of getting breast cancer. A family history of breast or ovarian cancer. Having a family history of breast cancer may increase risk for breast cancer. For example, risk may be higher if a person's mother, sister, or daughter, or several family members on either parent's side of the family have had breast cancer, or if a relative had breast cancer at a young age. A family history of ovarian cancer or breast cancer in a male relative also raises risk. Previous treatment using radiation therapy. Women who had radiation therapy to the chest or breast, for instance, treatment for Hodgkin's lymphoma before age 30, have a higher risk of getting breast cancer later in life. You can lower your risk of breast cancer by taking care of your health. Maintain a healthy diet. Being overweight or obese, especially after menopause, increases the risk. A balanced diet and regular exercise can help with that. Be physically active. Regular exercise can help with weight management and independently lower breast cancer risk. Limit alcohol consumption. Even moderate drinking increases breast cancer risk, so it is best to limit or avoid alcohol. Avoid tobacco. Smoking is linked to an increased risk of breast cancer and other cancers. Breastfeed if possible. Breastfeeding can lower the risk of breast cancer. And make healthy food choices. Eat a diet rich in vegetables and low in added sugars, trans fat, and processed foods. Screening is an essential part of prevention and catching the disease in its early stages. The current recommendations for breast cancer screening in the United States are based on the guidelines of the American Cancer Society and the U.S. Preventative Services Task Force. Women aged 40 to 44 should have the opportunity to begin screening if they choose to do so. Consult with your doctor about any pre-existing risk factors. Women aged 45 to 54, annual mammograms are recommended. For women aged 55 to 69, mammograms every 2 years or annually based on individual risk factors. For women aged 70 to 79, mammograms may be considered based on individual risk factors. For women aged 80 and older, screening is generally not recommended, but individual circumstances should be considered. Mammography is the recommended primary screening method, but breast MRIs may be recommended for women at high risk. Women should discuss their screening options with their healthcare provider to determine the best approach for them. Screening should be part of a comprehensive breast health plan that includes regular self-exams and professional breast cancer screenings. It's important to note that these guidelines are recommendations and may vary depending on individual circumstances. If you know someone who has been diagnosed with breast cancer, whether you're a spouse, partner, family, or friend, you can support that person by providing a combination of emotional and practical assistance. Emotional support includes listening without judgment. Be an active listener and validate their feelings without immediately offering advice or trying to fix the problem. Acknowledge their feelings by saying things like, "I'm sorry you're going through this," or "I'm thinking of you." Try to maintain normalcy by continuing to engage in everyday conversations and activities they enjoy to help keep their mind off the illness. Manage mood changes by recognizing that mood swings can be a part of the process and help them manage any depression symptoms with support and, if needed, professional treatment. Practical support looks like helping with appointments. You can offer to drive them to their appointments, take notes, and help with decisions and treatment. Assist with daily life by helping with cooking, cleaning, running errands, and childcare to reduce the daily burden, and encouraging healthy habits. Help them stay active with gentle exercise, like daily walks and preparing healthy meals. It is also important to support yourself, whether you are a patient or a caregiver. Prioritize self-care by eating properly and getting enough sleep. It is crucial for caregivers to make time for themselves to avoid burnout. Communicate openly. Talk about how you're both feeling, including anxieties about intimacy and physical changes during and after treatment, and consider couples counseling if needed. Caregivers should also remember to address their own needs. Seek your own support system by talking to friends, family, or a support group to cope with the stress of caregiving. If you have any further questions about screening or breast cancer in general, please reach out to your healthcare provider. For this week's wellness practice, we will be doing box breathing. Just like a box has 4 sides, box breathing has 4 equal parts. You'll breathe slowly, counting to 4 times. 4 counts in, 4 counts holding your breath, 4 counts out, then 4 more counts holding the breath after the exhale. One of the biggest benefits of box breathing is relaxation, especially in times of stress. Regulating your breath can lower levels of the stress hormone cortisol and maybe even help lower blood pressure. In times of stress, your sympathetic nervous system is on high alert. Box breathing can help you move out of that state by tapping into the bodily system responsible for rest and digestion, the parasympathetic nervous system. The parasympathetic nervous system is the opposite of the sympathetic, otherwise known as fight or flight. When we feel stressed or anxious, our breathing becomes shallow and quick, which creates more anxiety in the body. The breath can be a powerful tool to help our bodies feel calm, safe, and grounded, and to move out of fight or flight into the parasympathetic rest and digest state. Connecting with our breath has benefits even when we're not stressed. It is a way of practicing mindfulness, connecting with the body, and creating awareness of the present moment. Now let's move on to the breath. Before we begin, we'll just take a moment to notice how you're arriving in this moment. How is your mind and your body feeling? Are you feeling scattered, anxious, or calm? Are you feeling tired or energized? Whatever you are feeling, no judgments, just noticing. We'll start by taking a deep breath in through the nose, then breathing out slowly, releasing all the air from our lungs. Now we'll breathe in through the nose, and as you do so, slowly count to 4 in your head. Be conscious of how the air fills your lungs and stomach. Now hold your breath for the count of 4. 1, 2, 3, 4. Exhale for another count of 4. 1, 2, 3, 4. Hold your breath again for a count of 4. 1, 2, 3, 4. Now we'll repeat that 4 times. Breathe in. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold it. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Breathe in. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Breathe out. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Now we will allow our breathing to return to normal. Once again, taking a moment to notice how we're feeling after we have moved through that box breathing exercise. You may notice that you're feeling more calm and more relaxed. Whatever it is, just notice it. And as always, no judgments. If there's anything from this episode that you'd like to learn more about, or if you have any physical, mental, or emotional health related questions that you'd like to be answered on the show, please reach out to our team by email at nsbhealthpreventionbrw@north-slope.org. That's NSB Health Prevention brw@north-slope.org, or by phone at 907-855-8501. Please note that we record our episodes in advance, so the answer to your question will air a couple of weeks later. Now, on to some announcements. Our 30 Miles a Month Winter Wellness Challenge is ongoing. This initiative is designed to help you stay moving and motivated throughout the long, dark winter days with one monthly challenge and weekly challenges to keep you going. You'll log 30 miles a month and get it signed off by a partner for 5 entries in our monthly prize raffle. By completing one weekly challenge, you'll get 1 entry. By completing every weekly challenge throughout the month, you'll get 3 extra entries. All participants who complete a log throughout the 3 months will be entered into a grand prize drawing at the end of our initiative. We'd like to thank ASRC for sponsoring prizes for each community throughout the challenge. If you'd like to participate, email us at nsbhealthpreventionbrw@north-slope.org, and we'll send you a log. On November 13th, our prevention team will be in Nooksut for the ConocoPhillips Job Fair. Come say hi to the team and learn about what it means to be a health educator and how our unit works to support the health and wellness of each of our North Slope communities. On Friday, November 21st, from 5:30 to 7 p.m., we are partnering with ASNA for a family kinship night at the Borough Lions Club. This event is open to the entire community and is a way to engage in healthy activities and healthy relationships. Activities will include board games and arts and crafts. Snacks will also be provided. Thank you so much for tuning into the show. We hope you found it insightful and learned something that can help you on your own health and wellness journey. If you'd like to catch the replay of this episode or any of our previous episodes, you can visit the North Slope Borough Health and Social Services YouTube page. Until next time, Koya Nakbak.